Now let's welcome Dr. Amruta Padhye to the check-in. Dr. Padhye, thanks so much for being with us today.
Thank you very much for having me, Janet.
So today, this time is a very challenging time. Let me just start, Dr. Padhye, with a really general question. Parents navigating child health right now, particularly the health of young children who are going to clinics, going to the hospitals, maybe have delayed some things, but are making these decisions right now. What general things are you observing, and what advice would you give right now?
Right. So we have seen declines in clinic visits more so not just because parents not bringing their children, but also because we had been postponing some of the routine, visits. But now we are really looking forward to ramping that up.
We're talking with Dr. Padhye today about how MU Health is making preparations to make the clinics safe, to make the hospitals safe for your infants, for your kids to come in. Let's go back to Dr. Padhye. Dr. Padhye, thanks for your patience with us while we figure out your line. You were just talking about some of the challenges, and particularly with vaccinations. Can you start that over and let us know what's going on with vaccinations right now, and what you would say to people with young kids on getting into the clinic and staying up with their vaccinations right now?
Thank you, Janet. Thanks for having me back on. So earlier I was alluding to the CDC report that came out on 8th of May, which kind of confirmed our suspicion of what would happen with declines in immunization rates. So when vaccination rates were compared to same time last year, January to April, there was definitely a considerable decline. And just for the period of mid-March to mid-April, based on some of the Vaccines for Children program data, they showed that about 2.5 million fewer doses of routine non-influenza vaccines were delivered in this mid-March to mid-April period. And again, for the same period, 250,000 fewer doses of measles-containing vaccines were given when compared to the same time last year. So this is really very important because we don't want to see a surge of vaccine-preventable infections. Last year, we saw over 1,000 cases across the country of measles. Missouri has had the hepatitis A outbreaks. And also in Boone County, we had few cases of mumps reported last year. So we want children to continue to be safe during this time, and would encourage families to keep up with the well child checks. Most families like to do, at least I like to get our children's well child exams done during the summertime. So this is the perfect time to go back to the pediatric offices, get kids up to date on their vaccinations. I think one of the worries that parents have is that they're worried to go back into the health system, but all pediatric offices, including MU Healthcare, are taking every precaution to make visits to the doctor safe for you and for kids and their family, for parents and the kids.
All right. Let me just remind your listeners you're listening to The Check-In. Our guest is Dr. Amruta Padhye. Thank you for your patience while we fixed Dr. Padhye's line. We're talking about children's health issues during a pandemic. How are you talking to your kids about the pandemic? Do you have questions or comments for Dr. Padhye about getting your kids to the doctor, about vaccinations, about keeping your family safe? Maybe you're wondering about whether and when you can get your kids with their grandparents. All these questions, I feel like Dr. Padhye is going to have an answer for you. Call in and join the conversation, or let us know what's going on with you, your stories, 882-9136. We've got a few minutes left here, and we can take your call. There's a line open if you want to join us. Dr. Padhye, it's changed taking your kids to the doctor these days. What does it look like when you take your kid to the doctor? What, if you haven't been out there yet, what would you find that's different?
So what is different is that pediatric offices have changed their workflow in checking in kids. So typically, the families will get a pre-screening phone call. At the entrance of the clinic, there will be temperature checks. There will be a provider there to even do a symptom check to see if you may have symptoms of COVID-19. And if they do flag up as having any symptoms. Sick patients will be isolated in a separate area. Also, as of now, we are having all children and patients coming into the system wear masks, at least for those 2 years and above. And waiting areas are also different, where seats have been moved apart to maintain that 6-foot distance, physical distance. Also, if anyone does not need to be seen in person, then virtual care is definitely an option. And all of us have opened up clinic slots for being able to see patients by telehealth. Again, for children or adults who have scheduled procedures that require sedation, or those who have planned surgeries, they're having tests for COVID-19 done in advance of the procedure, so that those who are positive, then we can decide whether or not that procedure or that surgery is necessary at that time, kind of weighing the risks and benefits at that time. Okay. So these are all the systems that have been put in place to make families feel comfortable coming into the health system.
All right. Dr. Padhye, there are a few specific examples that I feel like are on a lot of people's minds, sort of at the various stages of parenting that they might be in. So let me just kind of go through some of these examples and stages for you, beginning with our conversation that we were having with reporter Rebecca Smith about childbirth. What advice or observations do you have for people planning a childbirth right now?
So I think following directions from your OB doctor would be the best. All of our physicians in our health system are very familiar with. And I really liked all the comments that Rebecca Smith made earlier about childbirth. Again, trying to avoid contact with, of course, sick people, but also kind of staying isolated from others, avoiding visitors, and maintaining that social distancing until the time of childbirth.
Okay, great. And what about you and your husband are both physicians, I believe, and working parents. You have young kids. What do you say to working parents considering the various options such as daycare and day camps? I saw that lots of summer camps have opened up. They're following different procedures now. What are your thoughts on the safety of daycares and day camps right now?
Yeah, I think we have also been considering what we should be doing for our kids come summertime.
Yes.
I think when we screen through these camps, we are kind of being mindful of what precautions they've put in place for their camps. Are they aligned with the recommendations from the health department? So that would be the first thing that I would look into. Of course, their teacher or supervising camp counselor to student ratio should also be there should be fewer kids to a counselor than they would have otherwise had in the past. Again, I think outdoor activities are great. Outdoor camps would be great, but again, trying to maintain that if we should be mindful of knowing if social distancing is possible in these situations.
Okay. And, being a parent yourself, you and your husband are navigating all of this. What would you say you have found the most challenging thing about being a parent yourself during this pandemic?
I think for us, the challenging thing was trying to juggle both our respective duties. My husband is a critical care doctor. I'm an infectious disease doctor. So trying to balance both of these with also balancing the e-learning that the children have been doing at home. So that was the most difficult piece. Our kids have been very, very understanding. They know that mom and dad do important work, and we provided reassurances to them. We provide frequent reassurances to them. We tell them that when mom and dad go to work, we're going to be, keeping ourselves safe by doing all these things. So I think the anxiety has not been very much for the kids, and they've been doing a good job with keeping up with schoolwork.
Well, that's remarkable considering that you must have a high level of stress, you and your husband, that you're probably accustomed to dealing with. But I appreciate you sharing your personal side of things because it's very relevant to have you both as an expert and also as a parent here. So we couldn't resist a few questions about how you're dealing with yourself, all of this yourself and your family. And you
Yeah.
mentioned really kind of my next question, Dr. Padhye, which is about how you are talking to your kids about this. And you say you've managed to keep their anxiety pretty low just by talking about it. It's probably conversations you've always had in your family about what you do. So perhaps this is just an added layer. But what do you think works when it comes to talking to kids and explaining what is going on out there in the world right now?
Mhm. So, with my kids being in elementary school, they're familiar with what is going on. But at the same time, I asked them initially when the pandemic started, I try to, and even now intermittently ask them, what do you understand is going on? And that way, if they have any, if they've heard some misinformation, I can correct that. I would recommend a particular website from our American Academy of Pediatrics. It's called healthychildren.org. It has really good tips for families on how to communicate with children, how to recognize any signs of anxiety that they may not express verbally, but that what to watch for if kids are being cranky or clingy or having trouble sleeping. And there are a number of tips out there as well. So I would really encourage families to kind of explore that website. I think the other big thing is trying to also for adults to stay informed, so you're aware of what's going on, and try to be like a good role model in a way, if I should say, like knowing to express like sympathy and support to those who are sick, and at the same time being mindful of what is being spoken in front of the kids. Is it age appropriate, and not to unnecessarily frighten them as well.
Okay, yeah, great advice. Let me just remind listeners this is the check in on KBIA. We're talking with Dr. Amruta Padhye about children's health, maintaining your children's health during the pandemic, how you're talking to your kids about the pandemic. We're calling on her to be a little bit of a therapist, but she's a infectious disease, pediatric infectious disease expert here. And so sharing with us advice and observations about keeping your kids healthy, whether you have questions about getting your kids vaccinations, planning a childbirth, how you're dealing with this in your family. Let us know what you're dealing with and what your questions are. Dr. Padhye, I really wanted to ask you about something that's kind of newsworthy at the moment, this mystery inflammatory syndrome that's come out, which is believed to be associated with coronavirus, but it's still very rare, I think. But is it a concern? I think it's officially pediatric multisystem inflammatory syndrome, which is worrying, but again, very rare. Is this a concern you're watching here in Missouri?
Yes. So in Missouri, all providers are aware of this new description of the pediatric multisystem inflammatory syndrome. I'll call it just for short as PIMS. We have not had any cases here recently, but I know there are in the news there was some cases reported from St. Louis and Kansas City. But I think just being mindful of what symptoms to watch for. Like you mentioned, this is definitely rare, and what has been seen is that these cases, at least in the high incidence areas such as in New York, in the Northeast, they kind of became more apparent a few weeks after the peak in those areas. So we think of this as possibly a post-infectious inflammatory process. Symptoms to watch for. Again, it is rare, but I think it's not going to go. Parents are not going to miss these symptoms. If a child has been having fever for a few days, 3, 4 or more days, they're feeling unwell, some descriptions of abdominal pain, some gastrointestinal symptoms, feeling dizzy. Those would be reasons to have them evaluated by the doctor.
Okay. All right. Dr. Padhye, we are out of time, but let me just give you a few seconds here to give any advice that you would leave us with for keeping our kids safe going forward in this pandemic. What would your final observations be about going forward?
I think going forward, we should just be, again, one thing that this pandemic has shown us is how vulnerable we are. But again, we're all in this discovery phase of this disease. I would advise that people be prepared, stay calm, and continue to follow these social distancing measures that we have been following for the last few weeks, even now, even after the stay-at-home orders have been lifted, to continue to practice that. That would be my advice.
All right, fantastic. Dr. Padhye, good luck to you, your husband, and your family as you navigate and as you're a frontline healthcare provider during this crisis. We appreciate so much you taking the time and talking with us today.
Thank you, Janet. Thank you for having me. I
Yeah.
appreciate it.
Okay, thank you. Take care. All right, that's it for today's check-in. Thanks for joining us and checking in with us today. Thanks also again to Dr. Amruta Padhye for joining us.